Good morning, everyone, and thank you for joining this NSA webinar titled Mental Health Resources in Schools. This webinar will be recorded and posted on our website. We will have time for questions today at the end of the webinar. Please keep yourself muted at all times and use the chat box to submit your questions. Next slide, please. Today's webinar is supported by the COPS Office through our Cooperative Agreement for School Safety and Security. Thank you to the COPS Office for your support with today's webinar. Next slide, please. Before I introduce you to our facilitator today, I will give you a quick overview of NSA. Chartered in 1940, NSA is a professional association dedicated to serving the Office of Sheriff and its affiliates through education, training, and law enforcement resources. NSA provides these resources and advocacy for sheriffs, law enforcement, criminal justice professionals, and their communities. There are currently over 3,000 sheriffs nationwide. Our membership base includes over 13,000 individual members, including sheriffs, deputies, other law enforcement officers, public safety professionals, and concerned citizens. Next slide, please. Our facilitator today is Jeff Allison. Jeff began his law enforcement career as a trooper with the Maryland State Police and then served as a field training officer and juvenile detective with Aurora, Colorado Police Department. He then moved back to Washington and completed a 30-year career with the U.S. Department of Justice, with the last 11 years serving as the Special Advisor for School and Campus Safety, Public Safety at FBI headquarters. Jeff now staffs and serves as the chairperson for the COPS Office School Safety Working Group. In that capacity, Jeff helped author the 10 Essential Actions report, which is the basis for today's webinar. And with that, I'll pass it over to you, Jeff.
Thank you, Christy, and thank you everyone for joining us. I know it's become popular at the beginning of virtual meetings to lament the fact that we're not meeting in person, and I agree with that. But it also occurs to me that we were headed in this direction even before COVID toward more and more virtual meetings. So I think for those of us who are not Zoom warriors, we feel like we've been dropped in the deep end of the pool, but we are swimming. That's the good news. So let's swim into today's timely topic. The issue of mental and behavioral challenges that our students are facing is timely because we all know that schools are gearing up to bring students back. And there's at least observational evidence that those students will be bringing back with them a whole host of mental and behavioral health challenges. So we're going to talk about some of those challenges and how best we might be able to address them. Learning objectives in front of you there, proactively identifying behaviors of concern. I would point you to the National Averted School Violence Database that is funded by the U.S. Department of Justice, Office of Community Policing Services, and administered by the Police Foundation. There were almost 200 cases in there of planned targeted school violence that we were able to prevent through three fairly simple steps. Identify the threat, communicate the threat, and act on the threat. So all of us obviously want to be focused on that first learning objective. Adverse childhood experiences is becoming huge. All of us understand the imperative of trying to identify children and young people who are struggling as far upstream as possible, so we can get them the help that they need before they enter onto the pathway to violence. Talk a little bit about the role of law enforcement on behavior threat assessment management teams, and the next one, the standardized violence prevention protocol. There's a preliminary investigative checklist that we've developed through that project that I'll talk with you a little bit about, and then we'll also talk about the milestone project. Next slide, please. We're fortunate to have two outstanding subject matter experts joining us to talk about student behavioral and mental health challenges today. Dr. Melissa Reeves is an associate professor at Winthrop University. She's the past president of the National Association of School Psychologists. She's a nationally certified school psychologist, licensed clinical mental health counselor, and a licensed special education teacher. Melissa is a senior consultant with Sigma Threat Management Associates and also a special advisor for Safe and Sound Schools. Melissa has already done a webinar this morning, and this afternoon she has 4 hours of teaching to do as students return to Winthrop University today. So Melissa is definitely a warrior for us. We're glad you're with us, Melissa. Thank you. April Rhodes, next slide, please. April is the president and chief executive officer for Spectrum Healthcare Group and Touchstone Health Services, which strive to meet healthcare needs in Arizona through statewide community solutions and focused care. April is a member of the National Sheriff's Association School Safety Committee. April and her husband, Sheriff David Rhodes, created the Yavapai County Mobile Crisis Team to avoid jailing those experiencing a mental health crisis. And the results of that have been nothing short of phenomenal. So, Melissa and April, we are thrilled to have you with us. Next slide, please. And setting the stage, we're going to, Dr. Reeves is going to go first and followed by April, but just setting the stage for this conversation, Melissa and April. Recently, I saw an article in the Raleigh News and Observer newspaper where a reporter interviewed two adolescent mental health specialists. And I just want to share real quickly, again, to set the stage here, some of the things that those two adolescent mental health specialists said. One of them indicated that the number of children and adolescents she has counseled has doubled since March, and much of that as a result of the isolation young people are experiencing due to the pandemic. The other person talked about the impact on children and adolescents with learning disabilities who are really struggling, as well as kids from less well-off families who can't afford private mental health care. One of the specialists said her clients are experiencing an overwhelming feeling of despair. With that backdrop, Melissa, I'll turn it over to you.
Yeah, good morning, everyone. Without a doubt, data is showing us all over the board with all different age groups, the tremendous impact that the current situation that we're facing, not only in this country, but also internationally, is having on our mental health. And so that's one of the things that that I want to talk to you about today. And I've been given 25 minutes when honestly I could turn this into a 5-day workshop. But is what are those things, for us to be looking for within the youth that we serve within schools? But also, what are some things that we can do to help them, but also help ourselves? So I want to start off with talking about what are some of the signs and symptoms of stress and trauma. And I like to use this visual because even there are days where even myself, I am feeling like this and just wanting to rip my hair out and going, oh my gosh, is this ever going to end? But one of the things that we have also seen in some of the popular media is that they are using the terms stress and trauma interchangeably when really there's some differences there. But there's no doubt that stress and trauma can impact behaviors, which then can also impact our interactions with kids, which then can also impact how we manage those behaviors. Are we doing it in a way that's more positive, or are we doing it in a way that's more punitive? And then that's where that whole threat assessment piece comes in for those that might demonstrate some or express some of their frustrations more through threats versus in more adaptive and positive ways. So to start with, and go ahead and advance to the next slide, to start with here is stress. And how do we define stress? There's actually 3 different types of stress. And when I talk about this, I want us to look at this not only through the lens of the children and adolescents that we serve in schools, but I also want you to look at this through the lens of you personally, and then also colleagues that we work with, because all of us are experiencing this. There is what we refer to as positive stress. Now, some of you are probably going, oh, that doesn't make sense. Like, how can stress be positive? Stress we usually perceive as negative. There actually is a thing called positive stress where it is actually necessary for normal development. So when we have moderate, short-lived stress responses, like an impending deadline of something that we were supposed to get done, a day that is really busy, full of appointments, or these days, virtual meetings, it's that positive stress that motivates us to get things done. It is positive stress that actually motivates us at times to try things differently, to take a little risk and see, and which then leads us into developing a new skill set. But what it is that, again, it's short-lived. And then physically and emotionally, we can kind of return back to baseline. And that positive stress is more adaptive. But then there is this thing also called tolerable stress. And what that is it is potentially harmful if we don't have supportive buffer systems in place. So what tolerable stress is it's those short-lived acute stressors. So this may be where, for the students we work with, they had a relationship breakup. They received an F on a test when typically they're a pretty strong student. If you have the right support systems and relationships in place to buffer those stressors, then it is more tolerable. Okay? If you don't have those in place, then it goes on to be more potentially harmful. Then we have what we call toxic stress. And what that is basically is when we have strong, frequent, prolonged activation of stress mechanisms. So it's not positive and tolerable, but it's stress that continues to happen over time, or there is an accumulation of stressors. We're going to talk about adverse childhood experiences in just a bit. And in absence of some positive buffers with support systems, relationships, resiliency built, it does become toxic. And what we do see is negative impacts on not only physical functioning, but also academics and social relationships, which I'm going to talk more about in just a little bit. So when we talk about, and go ahead and go to the next slide, is what this kind of looks like from a physiological perspective, is if it is more of the tolerable stressor, there is a perceived threat, okay? Your adrenaline gets rushing, you've got a little physiological changes there. And for many of us, there is the kind of this fight or flight response that many of you might have learned about. But when that tolerable stressor subsides, or you have support systems in place to help you through that, your body returns to baseline physically, also emotionally, and you're able to continue to move forward. So there's not any long-term implications. So it's kind of this moment of time where physically and emotionally you have some reaction, but then you're able to calm down and you continue to move forward. Where this differs when we go to complex trauma or toxic stressors, go ahead and advance to the next one, is that there are definitely differences here because you have a perceived threat. You do have those physiological changes. You do have the fight or flight. But when there's multiple traumatic events or an accumulation of stressors that are ongoing, the challenge is your body doesn't return to baseline. So what happens is you're in this constant state of heightened awareness, right? And go ahead and click one more time and you'll see some animations that fly in here. Is you're in this constant state of heightened awareness. Physically, it can have negative implications because, again, your body is just not in a healthy state. Emotionally, you are much more susceptible to threat cues. So what I might perceive as a neutral stimulus, a person that is experiencing more toxic stressors is going to have that strong reaction. Either physically, emotionally, verbally, behaviorally, they're going to have a strong reaction. It impacts learning because you're kind of always on needles, like, am I safe? Am I going to be safe? Your brain is then not available to learn, and it does impact our emotional regulation. So a lot of the kids in schools, that especially those that have more of a trauma history or an accumulation of traumatic stressors or adverse childhood experiences, go ahead and advance to the next slide. We see this come out in their behavior, and we also see it come out in their mental health needs. But unfortunately, when we don't understand that this is more of a trauma reaction, we run the risk of misinterpreting that as being oppositional, defiant, conduct disordered behavior. And then we handle it in a punitive way, which actually sends them down a more negative pathway than handling it through an intervention approach, which can really address some of these underlying issues. So when we talk about, adverse childhood experiences, because as Jeff mentioned, it is definitely something that is gaining momentum and gaining attention in schools. What the studies that they have done, one of the original studies that was done, showed that over 40% of children and adolescents that were served by the National Center for Traumatic Stress Network experienced 4 or more different types of trauma or adverse situations. The highest being a traumatic loss, bereavement, or separation from primary caregivers, domestic violence in the home, having an impaired caregiver, or emotional abuse, neglect, physical and sexual abuse. What we are now seeing, and what the concerns are, given the fact that we have been, isolated from the traditional school environment, is while we have seen rates of domestic violence and child abuse, the reporting decreasing because the kids are not in schools. And a lot of times those reports come from those of us in schools that recognize it. By no means does that mean that the rates of it are technically decreasing. We actually are hearing reports that there's an increase of domestic violence in the home and abuse and neglect because of the significant stressors that many of our families are experiencing. In that case, the COVID-19 situation that we're in, and then compound that with a lot of the political unrest that kids are now being exposed to, some of the social and racial injustices that we're seeing in our country, that now can, for many students who don't have the buffering supports, can certainly turn into the toxic stressor, for which then we're going to see more emotional and behavioral needs. So it's really important, when we look at some of not only the data, but the current dynamics that are going on, go ahead and advance to the next slide, is that we have an appreciation and an awareness for the fact that how this toxic and complex trauma can impact behaviors, academic achievement, and relationships. There is no doubt that when you have someone who's experiencing toxic stress or they have a significant trauma history, it impacts their ability to trust others. It impacts their ability to form positive relationships. So some of you probably have experiences where you've tried really hard to connect with the kids you serve, and they just keep pushing back. And what you get is a lot of resistance, or you get a lot of oppositional behaviors. A lot of that is not so much because they don't like you, okay, or they don't need your support. A lot of that is because they don't know how to form positive attachments. They have not necessarily been in environments where they can, quite honestly, trust the adults around them. So as we're trying as hard as we can to connect with them and to help them, a lot of times we get a lot of pushback from them. And again, instead of seeing that as oppositional behaviors, looking at this through the lens of, could this be trauma-based? Could some of these behaviors that we're seeing be because they have a trauma history that has never been appropriately treated? What we also know is that it affects their self-concept and their future orientation. So many of these individuals don't seem to care about school. What do I need to be in school for? This isn't going to do me any good. I hate everybody around here. Because quite honestly, especially if you're in a toxic environment day after day after day, they don't have a lot of hope that their situation is going to change. Now, we know that through social emotional learning, through mental health supports in schools, through really good engagement with law enforcement and our school resource officers in schools and other support staff, we can give them that hope. But a lot of times we have to work through their pushing back first for them to trust us, in order for them to see that, while trauma situations can impact who you are, it doesn't define who you are in the future, and really empowering them. We also know very clear data that trauma impacts their ability to attend and to learn. I'm going to talk a little bit about how it impacts the brain in just a little bit. And also that it impacts behavior. Some individuals are going to internalize. You're going to have some that are going to externalize, and which then impacts their ability to emotionally regulate their emotions. Again, I'm going to talk more about that in a couple slides. And then what clear data is showing us on the ACEs research is that it also impacts physical health. So toxic stress doesn't just impact emotionally, literally it impacts physically. And these individuals have more health problems than those that are not exposed to toxic stress. And then there is, again, that detachment piece, difficulty forming relationships because they just have difficulty trusting individuals. So when we talk about the impact that complex or toxic stress can have on the brain, and go ahead and advance to the next one, there's really three main areas that it impacts. It impacts what we call our thinking center. And what that means is toxic stress, our thinking center is underactivated, which means no wonder then we're not making really good decisions, and they struggle to learn. It also impacts our emotional regulation center. That is also underactivated. So then again, they have difficulties in managing their emotions. But the fear center is actually overactivated, which leads to some of them having these real quick responses to particular antecedents or stimuli, in comparison to someone who doesn't have that. So, when we take a look at brain scans, there is actually science that shows that the brains are different in those individuals that have experienced toxic stress than those that have not. Different parts of the brain light up more than others. And so it does have physiological changes. So a lot of times we just want to blame the kid. And by no means, can we excuse some of the negative behaviors that can impact safety in schools. But we also need to understand that for some of these kids that are in toxic environments, it is changing the structure of their brain. And so some of this is under their control when we can teach them the strategies to use. But then there's other parts of it that are just these knee-jerk reactions because of the impact that it's having on them physiologically. So through our mental health interventions and supports in schools, we really need to educate them about what is trauma, how is it impacting your brain, and having them recognize that when they have a physiological symptom, that is an indicator that you're about ready to lose it. And then you need to integrate the strategies. So there are things that we can do, but we need to be able to really get in there and provide, additional supports with many of these students. If you flip to the next slide, there is this, Dan Siegel has this great model that we love to teach to kids. And I'm just going to give you kind of the down and dirty of this here. But basically, what we do is we kind of use this hand analogy. And we teach the students that, that your fingers up here are really the thinking part of your brain. It's where you think, it's where you problem solve, it's where you plan, it's where you, it's your emotional regulation center. It's also where you're creative, and it's where empathy resides. And when we do this curriculum with them, what we teach them is to kind of develop character names for your upstairs brain, like calming Carl, problem solving Pete, creative Craig, flexible Felix. And when you're in that calm physiological state, your thinking part of your brain is what's taking over. Okay. And that is where you're able to have, adaptive skills, which also keep you out of trouble in the classroom. The downstairs part of the brain here is the feeling part of the brain. And this is where your instinct for survival originates. This is where, you're looking for danger. And when you're in a dangerous situation or there's a perceived threat, this is where the alarm center is. So we develop names for characters, like alerting Allie, frightening Fred, big boss Bootsy. And so we teach them about the characters. What happens when there is a perceived threat is basically they flip their lid, okay? And when that thinking center goes out the window, it's the fear center that takes over. And so he has this whole curriculum that has a way for us to really put this into a good analogy to teach students not only about, the impact of trauma and sometimes tolerable stressors, and you need to act, you need to utilize your skills, but in a way where they're also understanding some of the physiological effects that trauma is having on the brain. Because what I have seen with many of these types of students is that they start to perceive themselves as dumb, stupid, nobody likes me. And so they develop this really negative thought pattern and negative self-esteem, negative self-concept. And when we can really educate them about this, they start to see that, okay, while I have some challenges, not all hope is lost. Again, I can learn the skill set to overcome some of these challenges. So go ahead and advance to the next slide. So, when they have actually done some research, quite honestly, on a lot of kids that we're all engaged with as law enforcement and mental health, and what I mean by CD is conduct disordered youth, is that 60% of those with behavior problems had 2 or more of those adverse childhood experiences. In kids diagnosed with conduct disorder, very high rates of trauma that had never been assessed for and never identified because we handled them more through the behavioral realm. We never did a trauma screener. We also know that polyvictimization, meaning that they're victims of more than one type of abuse or neglect, increases the likelihood of them developing conduct disorder. And that maltreatment actually predicts adult arrests and violent offenses. And so I just want to keep this in mind, because the earlier we intervene and recognize these individuals, the more successful we can be on helping them onto a more positive pathway. So this then leads us into the importance of being able to have good behavioral threat assessment and management teams within the school setting that you are all serving on. And go ahead and advance it to the next slide. Is that many of these kids may end up coming to our attention because they made some sort of a threat. And so it is important now, and more states are passing laws requiring threat assessment teams in schools. Now, notice I'm using the term BTAM, Behavioral Threat Assessment and Management, because in schools, we are obligated to provide educational services. So it's not enough just to do the assessment. If there is a potential threat, we're also responsible in schools for providing the interventions and supports to manage that situation. And what do we know about a lot of research out there is that these individuals don't just snap. There is planning that goes into it. A lot of times there's observable red flags and warning signs that are there. They're on multiple people's radar screens. The problem that the challenge that we often have in schools, though, is that everybody is so busy, we don't have time to really come together and put all the pieces together. But what we know is when we do have a good process in place, we can prevent acts of violence, and many times we can get interventions in place to help these individuals onto a more positive pathway. Go ahead and advance. And so notice here that this is a multidisciplinary process. No one person should ever be doing this by themselves, nor should one person be making the decisions on how to handle a threat. And you're going to have a presentation, I think, in a couple months that's going to be more in depth into what threat assessment is. But I hope that as law enforcement, you are engaged on these teams. And your involvement is anything from consultative in nature to more direct involvement if the threat is more serious. Just because you're involved doesn't mean that you need or should take directive action. You also are incredibly valuable in a consultative way, and also many times as part of an intervention. So really the importance, again, of you all being surrounded by this multidisciplinary team. The other piece that is real important for us to recognize, and go ahead and advance, is the difference between making a threat and posing a threat. We work with a lot of different developmental ages. We work with kids with developmental disabilities that don't always understand the implications of their words or actions. We work with students that don't always read social cues well, so then they have a response to that. We need to make the distinction between making a threat and posing a threat. And when schools do not have a good BTAM process in place, I have seen kids make a threat out of frustration or anger, and the next thing you know, they're suspended or expelled. And nobody really took the time to look at what's underlying that. So we have kids that make threats, but they don't pose a threat. But how do we know if they pose a threat? It's when we start to see these pathway behaviors, so that we are seeing some ideation, we're seeing some specific planning, we're seeing where they're actually preparing, and acquiring the means to carry it out and moving towards implementation. Go ahead and advance. I think there's 4 animations here. It's not only making a threat, but we need to see pathway behaviors for them to actually pose a threat. If they pose a threat, then yes, we need to get in there and we need to intervene more directly. If they made a threat and we're not seeing pathway behaviors, it's still not okay for them to express their emotions that way. But there's ways that we can use conflict resolution, problem solving. Maybe they need an anger management group. We don't necessarily need to go to suspension and expulsion for those types of things. Nor do we need to go sometimes to suspension and expulsion when they pose a threat. Actually, that can escalate concerns. And quite honestly, by disconnecting a student, we then lose our ability to provide good intervention. So again, I don't necessarily have a lot of time to go into this, but what we know is that proactive interventions and supports is what's going to help an individual off the pathway to violence. Punishment alone does not change behavior. So suspension and expulsion used without interventions and supports, all we're doing is just transferring that problem potentially to the community, and we're not providing interventions and supports needed in order to help them onto a more positive pathway. So go ahead and advance. I just have probably about 1 more minute here. I'm going to just quickly cover this. There is also, we are seeing in some of the cases that we have researched where there is a link to suicide. So we want to make sure that we have good suicide prevention programs in place in schools, because a lot of times we can mitigate threatening behaviors by getting in there, identifying suicidal ideation, and getting supports in place before they feel the need to make a threat because they feel like, they're out of options. We also know that go ahead and advance, that while mental illness or mental health challenges are prevalent in many of those that make threats, we really need to understand that those with a mental health diagnosis, most will never go on to be violent. And that is by no means what causes violence. But what we do know is that if they are experiencing mental health challenges, it increases stressors and vulnerabilities. They may not have the right supports or treatment in place. And in absence of support systems and interventions, it can escalate risk. So there is a link to mental illness, but we really need to understand that most of those with mental health diagnoses will not go on to be violent, but it does tell us we need to get in there, we need to assess for risk, and we need to appropriately intervene. So I'm going to turn this over briefly to Jeff before I just highlight resource slides and turn it over to April, because Jeff has been involved, go ahead and advance, in developing a checklist. So Jeff, I'll help you talk about how to access that.
Sure, Melissa, thank you. So the COPS office made a grant award to the National Association of School Resource Officers and the University of Colorado to develop something called the Standardized Violence Prevention Protocol. And what this is about is preventing targeted school violence through information sharing and also through behavior threat assessment. One of the products that is going to come out of that project is something called the Preliminary Investigative Checklist. It's something we are developing for patrol officers, SROs. The officer that at 2:00 in the morning has to go do a knock and talk because the state tip line received information that this person is making threats online to shoot up the school the next morning. So you've got to go do that knock and talk. Obviously, as a police officer, you've been trained to figure out means, opportunity, motive, and intent. But what this checklist does is gives you some questions that help you answer those questions about means, opportunity, motive, and intent. We're hoping that this checklist may become part of an app that law enforcement agencies can upload. and their officers can use. So again, a sneak preview, hoping that Melissa, that we may be able to get that preliminary investigative checklist out this summer, and we'll make sure that folks know about it. And I think, Melissa, you wanted to talk about resources real quickly before April takes.
Yep. Actually, what I think, Christy, I think you're advancing the slides. We're going to go real quickly through just some additional resource slides. The first one is Safe and Sound Schools has some fabulous resources and user-made tools in regards to a lot of different areas of school safety. So highly recommend you take a look at their website. Go ahead and advance to the next one. The National Association of School Resource Officers has some really good training. Notice they actually have a training on adolescent mental health. Highly encourage that anybody in law enforcement who's serving in a school go through the NASRO training, because schools, it's a unique culture. And to receive the appropriate training, it is great. Go ahead and advance. Also, Sigma Threat Management Associates, it's a group for which I am a part of, is a national leader in providing good quality, behavioral threat assessment and management training and case consultation. We're a multidisciplinary team with years of working cases. And then also the National Association, go ahead and advance, of School Psychologists has some incredible resources, not only on COVID-19, but care for the caregiver. Even as law enforcement officers, you're also under tremendous stress these days. And our jobs, your jobs have significantly changed. And so some really good resources on self-care. And then for districts that are interested in crisis prevention, go ahead and advance through intervention and recovery, really developing good crisis teams and equipping their mental health personnel with how to provide multi-tiered crisis interventions and address trauma. This is another great curriculum resource for some additional staff development. And as I turn it over to April here, go ahead and advance one more, is really realizing that everything starts with relationships. And for many of these students with trauma histories and challenges, and their trust has been broken, and it really does take time for them to connect with us, but to remember that punishment alone does not change behavior. We've got to teach those replacement skills and build those relationships. And just remember the importance of those of us in caretaker roles, which includes law enforcement. Some of us also have our own trauma histories, making sure that we're attending to our own needs, but also reaching out for supports and remembering that everything that you do makes a tremendous difference in the lives of the kids and those communities that we serve. So thank you. And I'm going to turn it over to April. So thank you.
Thanks, Dr. Reeves. I'm incredibly impressed that you were able to provide such a comprehensive overview of the underlying role that trauma plays in so many of these situations. I think it's incredibly important. And so I'm just going to take a little bit of time to talk about putting all of that into action and what that's looked like for us in Yavapai County, located in Arizona, just to give some context to a lot of what Dr. Reeves has said. So essentially, Milestones Project is a multi-agency, multidisciplinary behavior threat assessment team in Yavapai County, made up of local law enforcement leadership, mental health leadership, school officials, and juvenile probation. And I think it's incredibly important to note too, as others are pulling together these teams, that it's really important to have either the leadership present as a part of those teams. And for the Milestones Project, it is really made up of the leadership of each of these sectors that are at the table kind of discussing what this looks like, or to, at a very minimum, have that really high level of buy-in from leadership. Because in order to make this actually happen, boots on the ground in real time, it's important to have the decision makers really involved in that process. And so located in Yavapai County, I want to give some context because we cover about 8,100 square miles. Which is about 1,000 square miles less than Maricopa County, which many people are familiar with. It's where Phoenix is. It's one of the largest population centers in the nation, but with a difference of about 26 people per square mile in Yavapai versus 414 in Yavapai County, and so, or in Maricopa County. So you can imagine that requires a vast geographic area to cover. And to complicate things further, we have about 26 school districts in Yavapai County overseeing about 60 schools. And so there's a lot of ground to cover there, but in spite of all of that, we've really been able to, in Yavapai County, bring together all this cross section that you see represented here, which is, the local principals of the schools, the superintendents of some of the larger school districts, the local police chiefs, the CEOs and chief clinical officers for the local mental health and physical health organizations that serve the area, CPS and DES, and also the juvenile probation system. And the whole idea, if you advance to the next slide, the whole idea of the milestone is to provide a kind of wraparound response. As Dr. Reeves mentioned, oftentimes when a child or an adolescent is identified as being at risk, the full weight of the system can kind of descend upon the child and the family, and it can be oftentimes punitive in nature versus coming in and kind of wrapping around the individual or the child or family and trying to get to the core issues behind what may be driving whatever got on our radar. And so the idea really is to make families and these adolescents feel as if they have help with this team. And so generally, referrals can be really made by anyone that comes into contact. And we do a lot of education about the Milestones Project in Yavapai County with all of these different sectors. But most often it comes to our attention through a school official making some sort of a referral. And sometimes that can involve law enforcement, or our mobile crisis team has responded in real time to the event at a school if it's something of that at that level. Or it can be that somebody came across a journal entry and it was concerning in nature because of something that the child or adolescent said. And so then they're just kind of calling to run it through the referral process. But the idea is that once that comes to our attention, then where the people who are involved in the Milestones Project have committed to dropping everything at that moment in real time to get together and have a staffing about what we think is the best possible response to assessing the threat in the community. And then we put together our resources on how we're going to do that. And that always involves the family. So we're reaching out and talking with the parent or guardian or whoever's in the home with the adolescent and getting their consent to be able to share information. It's a critical component of this successful team approach is being able to share information within the team setting, so that we're able to talk in real time with the family and then share that information with the school officials or engage the child and family in mental health supports or some sort of therapy in the home. As Dr. Reeves mentioned, sometimes there's groups that are needed to help support the individual or the family. And so we want to be able to share with the team what is happening with that family and with that individual so that they can feel supported and wrapped around. And so next slide, please. I want to talk just a little bit. This is actually, I wrote about this in the Sheriff and Deputy July-August 2020 issue about the Milestones Project in general, but also just kind of sharing a little bit about an individual that we helped. And there's some key factors, characteristics of this person's story that have been changed to protect confidentiality, including her name. But her story represents, some of what we've heard just in general when we have children get on our radar for the Milestones Project. And so this is about Abby, and she was actually, a lot of the things Dr. Reeves talked about are very present in this situation. In fact, when we became aware of Abby, she had made a threat. Things had kind of escalated to a tipping point. She had had an outburst in the classroom and threatened to physically harm one of the other kids. Made some statements that were very concerning to the teachers about how later she was going to come back and bring some things with her. And so we were, the referral was sent up to the Milestones Project. Mobile Crisis was activated. We involved the family and, got permission to talk about and share with. And it was a really great example because we actually met that same afternoon at the school. We had the sheriff at the time at the table. We had the local police chief. We have, for context as well, we have about 13 law enforcement agencies for 9 municipalities in Yavapai County. And so, oftentimes you can have multiple law enforcement officials at the table, but they came and did an incredible job of engaging this family and saying, we're really here to help support Abby. And we want to get to a place where you don't feel isolated from the system, but rather like it's a place to turn for support. And letting Abby hear that as well, that this wasn't intended to be punitive in nature. And so as it turns out, Abby was actually living in a foster family environment. So it was somewhat new to this family home, was feeling isolated, had a whole lot of things that Dr. Reeves talked about going on in her trauma history that had led to high level of distrust for, some of the officials in her life. It hadn't actually worked out that well for her in the past when she had, gone to an adult and said, hey, I'm having these feelings. In fact, it had led to her removal of, being in other family settings. And so she had really developed this distrust and had learned that when I say something, bad things happen for me. And so we had a lot of work to do to try to build trust with her individually, but also with that foster family who, the immediate response and for the schools as well is often to push them out, suspend from school, expel from school, or the foster family saying, you know what, this is too much for us and we can't manage this behavior. And so it took that full effort of that team to come in and wrap around Abby and that foster family to maintain that placement, to keep her in school, because as Dr. Reeves mentioned, the worst thing I think we can do in many of these cases is isolate them further into the home. Then we don't have an eye on what's going on. And there are so many resources available to surround, families and engage them in care. And so, Abby and her foster family were involved for some time, but they were made aware of all these services and had engaged in further supports even after closure from the Milestones project. And so it, for me, was one of there's common threads in this case. And I will point out too, that it's not, the children that we've worked with, the adolescents that we've worked with in the Milestones project don't always come from a foster family or, some of those things that are very apparent, that we may tend to look for. We have seen referrals from all types of family settings, all types of family histories. The common thread that is most certainly there in all of the cases that we've worked with in the 6 years I've been working with Milestones is a history of trauma that often looks a lot like some of these things that kids get diagnosed with, like conduct disorder. And, a conduct disorder diagnosis is a very heavy diagnosis for an adolescent. And so, our goal really is to go in and try to wrap around those behaviors and support the family and help them find different ways, those replacement skills that Dr. Reeves mentioned, so that they, in the next incident, they could manage something better and hopefully have a better impact. And so with that, I will wrap it up and turn back over to Jeff.
Thank you, April and Melissa, so much invaluable information that we can ponder and hopefully put into action in our everyday work to try to support students. Just so you know, reminder, we've got about 14 minutes left. So if you have a question, please type it into the chat box and we will try to get to it. If something occurs to you later, I believe the last slide is right there for you. Christy Barksdale at the Sheriff's Office, National Sheriff's Association. Please feel free to reach out to Christy with your questions. Again, this webinar is going to be posted on the National Sheriff's Association website, so you can get back into it. You can see Melissa's slide with contact information, April's slide with contact information as well. So it will be there for you. But just to get started, Q&A, Melissa and April, recently I learned a new term. I'd never heard this before, but the term is sad fishing. And sad fishing is when someone posts a really sad picture of themselves crying or with a really sad look on their face while telling an emotional or heart-wrenching story or describing an event to them. So I guess this is popping up on Snapchat, chat, and Twitter and other places. If we see that, if our officers, our teachers, our school counselors, our mental health workers, if they see that, or that's brought to their attention, is that something they should be concerned about? Is it the kid basically just trying to get attention? What are your thoughts on that?
April, do you want to go first or do you want me to go first?
No, please, Dr. Reeves.
Yeah, I definitely, that is something that you would want to make sure that somebody is following up on, because one of the things that we know is that, especially in today's day and age, and even more so in the virtual environment, is that kids are giving in a lot of indicators on these social media sites. So definitely somebody needs to follow up with that. They need to check in with that particular individual. I'm always honest with them, not necessarily saying who brought it to my attention, because you want that reporting to be confidential, but to be honest and say, you know what, this was brought to my attention and I'm worried. And then, conducting, whether it be some sort of a screening, if there's some suicidal indicators, you clearly need to do a suicide assessment. If some threatening behavior has been in there, then hopefully you've got a good behavioral threat assessment and management process. But definitely we need to pay attention to that, because what we have seen in almost most cases of suicide and almost all cases of targeted school violence, there were indicators like that they were struggling. And a lot of times those indicators were posted on social media. So we also have to train the students to come forward if you see individuals that are expressing those things. You're not narking, you're not getting them in trouble, you're getting them help. And that's what we do as part of a caring school climate. So so those are definitely some red flags that we would want to follow up on.
The other thing I would highlight there is the importance of that response. So it's critically important that people be willing to bring that forward to somebody's attention. But for especially students who are going to be the ones most likely to see that on Snapchat or social media, if they know that they're going to go and say something to a school official and the response is going to be negative, or they're going to get their friend kicked out of school or into some sort of bad situation, they're going to be very unlikely to bring that forward. And so I think, part of what we've tried to do too is to educate students and to engage kind of like peers in schools in, being that go-to person, so that they're at the same age, same level as some of the students that they might see posting things like that. They're trusted within the community so that they can bring those things forward and feel confident knowing that it's not going to activate this very negative response from law enforcement or from school officials.
Right. And April brings up a really important point as to why we want to make sure that there's good suicide assessment and behavioral threat assessment and management processes in place, and that one person's not doing it by themselves. Number one, you don't want one person to kind of have this snap judgment as to how it needs to be handled, but you must do the assessment first to determine the level of concern, which then guides how intensive and directive do our interventions need to be. And if it's because there's harm in both over and under responding, and April is absolutely right, if the adults that engage go to these rash judgment decisions and it leads to overly punitive measures, the kids are going to stop coming forward. And I've been involved in situations where that's happened, and then there were subsequent concerns, and the kids knew about them. They didn't come forward. And when I sat down and said, why did you not come forward? And their response was, well, Dr. Reeves, because everybody gets kicked out or everybody gets suspended. So we don't want to be a part of that. So we kept it quiet because we were afraid of how the adults were going to handle it. So, and just like, with law enforcement involvement on threat assessment teams, there's this fear of the school to prison pipeline. And quite honestly, I've worked with more SROs and law enforcement officers that said, when they pulled me into the threat assessment process, I was given the directive I needed to arrest this kid. And that wasn't appropriate. Well, the team process should also protect law enforcement from being forced to take overly punitive measures that are not appropriate. So that's why the importance of that process. And also, April, what I love about your program, it's that community approach, because the latest research that has come out on some of the more recent targeted school violent incidences, almost all of those individuals had significant family stressors going on. So it's not just about how do we intervene with the kid, but we've got to address the family stressors, and we need those collaborative partnerships like the Milestone program has to be able to do that. So I love what your program does. I wish we could mimic that everywhere across the country.
Thank you.
Thank you both for that response. And a question in the chat box, the term that we're referring to here is sad fishing. On social media. So again, when somebody posts a really sad picture of themselves crying or a sad look on their face while telling an emotional, heart-wrenching story or describing a traumatic event that occurred in their lives, Both of you, Melissa and April, have, I think, underscored something really important, is that we've got to educate our entire school community. Students, parents, teachers, counselors, law enforcement. We've got to educate them on what the indicators of potential targeted school violence are, what the indicators of potential self-harm are. That's where we start. And then the second step, obviously, as Melissa, well, you and April both referred to, is building community trust so that people will share that information with us. So you both also created a really good segue for me to mention to folks the last couple minutes we have here is that the National Sheriff's Association is going to be doing 3 more webinars this spring. In March, we'll be doing one on school resource officers. In April, with the help of the U.S. Secret Service National Threat Assessment Center, we're going to be doing one on behavioral threat assessment management teams. And then in May, Susan Payne, who many of you may know from her role in creating Safety Tel in Colorado, we'll be doing a webinar for us on anonymous reporting systems. So marketing for those webinars will be forthcoming. You'll see it. We hope you'll register and join us for those webinars. So wrapping it up, April and Melissa, for me, I guess the key takeaway is that if I'm a law enforcement officer in particular, and I'm dealing with a 14-year-old who is oppositional, I think what I hear you tell me is I shouldn't assume that the kid just has a bad attitude.
Right.
Yes.
Correct. Yep.
Okay.
Yes. And I would love to, yeah, and in an ideal world, I would love to see, law enforcement and school resource officers have a really good, close, collaborative working relationship with their school psychologist, their school counselor, their school social worker, their school nurses, and then developing those community partnerships. I spent a lot of time with my school resource officer, and it was awesome that, the information and the collaboration that we had to be proactive. Because, everybody's a valuable member of the team. So, yeah, absolutely.
Good. April, a last word?
Yes, and I agree completely. I think that, the more that we can engage as many community leaders as possible in the discussion, and as I think Dr. Reeves brought up an incredible point too, that law enforcement, who are responding to these things need to feel empowered to be able to respond differently, or have the ability to, not have this punitive approach, and my expertise is in behavioral health and marriage and family therapy, not law enforcement, obviously. So I know that there's different things that dictate what that looks like, but I think it's incredibly important that we have that collaboration between disciplines to talk about who can do what and build that trust in the community. So we're much more likely to have people engage us versus push away from us.
Fantastic. In April, we know that you are involved in law enforcement. You're married to a sheriff. So the collaboration starts at home, right?
We take our partnership seriously in Yavapai County. So yes.
Thank you again so much. I know a lot of us are pretty zoomed out, so it's especially gratifying to see so many of our colleagues joining us today. Thank you. Thanks, Melissa and April, so much for that incredible information. And finally, thanks to Christy Barksdale and the staff of the National Sheriff's Association for their awesome coordination of this event. And of course, it goes without saying, the COPS office at the Justice Department for making it possible. So with that, I'm going to turn it back to Christy.
Thanks, Jeff. Next slide, please. Huge thank you to Jeff for facilitating our webinar today, and a huge thank you to Dr. Reeves and April and the COPS office for all making this webinar possible. And thank you to our participants today for joining. My contact information is listed on this slide, so please contact me with any questions. Thank you again for joining, and have a nice day.
Thank you.